To both of you. Richard Di Natale, tell us about the policy.
Well, essentially what we're proposing is that we introduce a levy of 1.5% on the advertising of alcoholic beverages and junk food. That levy to go towards funding health promotion. So that would include things such as promoting fresh fruit and veggies, things that are healthy, things that are essentially do exactly the opposite to junk food, that is improve people's health rather than make it worse.
What assurances do you believe are there that the big food companies will actually pay that levy, or in fact choose to pay that levy, given their profits are quite big, and where that small cost?
Well, that's mandated by law. We'd make sure that was a bill introduced into the Parliament. It's important to note that they spend, the junk food and alcohol industry spend in excess of $250 million per year. This would be a very small fraction of their advertising budget, but what it would do is level the playing field a bit. We've got this issue in this country where prevention has dropped right off the agenda. We've had this big discussion around health reform, but it really has been about hospital finance reform, and prevention has fallen right off the agenda. We've got to put it back on there, and this is just classic health prevention.
Charlie, what sort of warnings would you like to see put on junk food, similar to the ones that we see on cigarette packs now?
Well, essentially what we need to do is provide people with information. Let me go back a step and just say this is in conjunction with the restriction of advertising of junk food to young children. So this isn't instead of.
Yep.
This is advertising that targets adults. The Greens have long supported the abolition of advertising of junk food to young children. We continue to maintain that position for all the reasons that Boyd suggested. But what we want to do is provide people with information. The amount of sugar that's in the product, the amount of fat that's in the product, and the amount of salt that's in the product. They're the three things that really do harm to people's health. And what we're just doing is providing that information. I suspect it would take the sting out of the advertising campaign of fast food companies, for example, if their glossy advertising budget was followed up with some reality, and the reality of what they're actually producing and marketing to young children and adults.
Looking at the politics of it, though, what you announced yesterday and what we're talking about this morning, isn't it just exactly what people might be afraid of when it comes to a Labor and Greens alliance? You are about increased taxes. You're talking here about a levy, which is just another way of saying tax.
Look, taxation is the price you pay for a civilised society. I mean, I'm not going to get into this argument about all taxation's bad. We pay taxes because...
No, but these parties go into these election campaigns saying we won't raise taxes. You're basically saying today that in conjunction with a Labor government, because that's where your preference deals has been, you will raise taxes.
Well, what I'm saying is that if the Greens were elected and if we had a role in the balance of power in the Senate, one thing we would be pushing for is a levy just like this one. That is on corporations. Let's be clear about that. It's not on individuals. It's on corporations that produce those products that essentially harm people's health. Now, I think that's good, classic preventative medicine. As a doctor, somebody who works in this field, it's all very well to act at an individual level, but unless we tackle prevention at a population level, we're just not going to make the inroads that we need to. So, sure, I've got no problem saying this is a tax on junk food. It is a tax. It's on corporations, and it's a tax that it will improve people's health. The other thing to remember is it's an investment. We spend in the order of $60 billion because of the obesity problem, and probably in the order of $15 billion when you consider all the social, health and economic costs of alcohol. As again, the health system has to carry that burden. By implementing a tax like this early, we actually take the pressure off the health system, and in the long run, I know that's not what politicians like, they don't look long term, but in the long run this is actually something that will save us dollars.
Could this be a quid pro quo, though, if indeed the Greens do hold the balance of power in the Senate and Labor is re-elected? Julia Gillard, you support this junk food levy tax and will support concessions on the mining tax or whatever other policy you choose to pursue?
In the Senate, we'll tackle each piece of legislation on its merits. We won't cross-trade one piece of legislation against another. We've done that consistently in the term of the last Senate. We'll make sure that each piece of legislation is tackled on its own merits. This is good public policy. It's got the support of a number of agencies. Vic Health came out just yesterday and said that they believe it's good public policy. Public health professionals believe it's good public health policy. This legislation stands on its merits, I believe.